Hey there. Nice to virtually meet everybody. My name is Mark Ryder, Head of Innovation at NFP, and I'm here today to talk to you a little bit about data. We're going to spend the next half an hour or so talking about the opportunity that data is presenting everybody here, and talk a little bit about why that is the case, what's brought about this access to data, and what you can do with that data, some ideas of what you might be able to accomplish within your health plan and your employee benefits package by utilizing data. That's Head of Innovation at NFP, and we are a global insurance broker. We support our customers, small and large, with corporate benefits and employee benefits, property and casualty, retirement, life insurance, asset management. And there is a lot of data that's accumulated in doing so. And it's my task to work with our business units to use the data to rethink what they do, the value we bring to our customers, and the way in which we conduct ourselves and conduct our business. And I'm hopeful that at the end of the day today, after this conversation, you'll be able to take some of the insights provided, take them back into your business today, and potentially use them to rethink the benefits that you're providing your employees and your workforce, and potentially have a better understanding of what data points can be of most value to you as you're navigating the employee benefits space. So without further ado, we'll dive into the presentation. So as I mentioned, what I'd like to do today is really take a step back before we just talk about strategies and ideas. I think that it's super important when you are executing within your organization on strategy, that you have a good understanding of why the opportunity that is being presented to you is available. And in this case, it's why is it the fact that data has become so readily available and can be used more now than it's ever been able to be used before to strategize and to plan. Because I'm well aware that as you charge forward, some of the initiatives will require commitment of resources, and you're going to be required to speak to your executive team, provide an ROI, and help them explain the opportunity. And I think knowledge is king. We talk about data being king, but knowledge is super important for you to have a basis for what's happening, so that when you move to execute with your executive team, you have the knowledge to present to them a true ROI and some rationality behind what it is that you would like to execute on. So we're going to start off with a little quiz. What does Google, Aetna, Amazon, Express Scripts, and Verizon all have in common? Now, I'm sure there are multiple answers to that question. You could tell me they're all very big and successful companies, and I would agree with you. But what I'm most interested in today, and it kind of plays a part into the conversation we're having around data, is the fact that every one of these companies is now involved in the health insurance and the healthcare industry. You certainly knew Aetna and Express Scripts and SOAR, but did you know Google and Amazon and Verizon are players now in the healthcare and health insurance space? That might be surprising to you, but I think another answer to the same question would be, what do they have in common? They all have a tremendous amount of data available to them, and they use that data to build their business. And I think the two of those items that I just mentioned go together in a very close way. Because the health insurance industry looks a lot different these days. I mentioned about those players being a part of the health insurance space. Google Health, healthcare. I don't know how many of you have seen this, but Google Health is actively pursuing health data to add to its already very rich data lake and information that they maintain on their customers and their members. subscribers, users. Amazon. You may have been very much aware of the partnership that they had in place with JP Morgan and Berkshire Hathaway. That has since disbanded. It was called Haven, but that hasn't stopped Amazon from continuing to innovate and bring solutions to the healthcare space and be very active in acquisition of players that fit in that platform. Tesla, another company, although not involved in the healthcare space, that has threw its hat into the ring around auto insurance and taking on some risk as they sell to their user, extending that platform to allow that user to also purchase insurance supported by their organization. And then Verizon, one that not many have seen, but one that launched recently, as early as I think it was April of this year, into the healthcare space by deploying a telemedicine solution. Might not have been something you thought about, Verizon getting into space, but it's kind of logical when you think about it. A mobile telephonic company that is already engaging customers on their mobile devices, on their cell phones, on their mobile laptops, now transitioning to what has quickly become a very popular way of accessing care as a result of the pandemic. So why is all this occurring? Why now? What has happened within the insurance space that has caused this focus, that has caused many newcomers to get involved? And I would suggest to you that it, although among other things, it is driven a great deal by the bad user experience that has been in place in insurance for some time. I don't have the statistics right in front of me to give you the exact order or ranking, but I do know that the insurance experience ranks among the worst when polled or surveying individuals. It's partially makes sense because a lot of times when you interact with insurance, it's after a loss and you're automatically in a worse state of mind. But we in the industry haven't done anything to really help improve upon that experience, from the purchasing of coverage straight through to the submission of claims. But that's beginning to change. And in part, probably driven by outside influences, outside players that are, threatening the traditional legacy players. Amazon, Google, Verizon. These are companies that have spent their entire existence focusing in on the user experience. They gather and gain a better knowledge and are able to position a better user experience because of the access they have to data and how they've chosen to use that data. Now, I'd like to take this now and talk to you a little bit about digital transformation, which I think is part and parcel with data. Digital transformation is spoken about everywhere these days, in part because of the pandemic. Folks have been forced to rethink what they do. They've been forced out of necessity to embrace some technology solutions they might have previously thought were nice to have. And so they are transforming their business to adopt digital technology solutions. And those technology solutions are the solutions that ultimately help in the gathering of data and the using of data to better the user experience. So what is digital transformation? Innovation, which really is driving digital transformation, or some might say the other way around, is the practical implementation of ideas that result in the introduction of new goods or services or improvements of those goods and services. I mentioned that I spend a lot of time working internally with our offices, and and our advisors and our employees, and helping them drive change within our organization. And when you really boil down innovation, it is about rethinking and being better. It's not about fancy words like AI and machine learning and natural language processing, although they certainly come into play. When you really break it down, it's about being better. It's about rethinking what you do. And so innovation and digital transformation go hand in hand, because it's the transformation, the adoption of the technology to be used to be better, to modify existing business processes, culture, customer experience, to meet the demands of the business and of the market in general. So that's why this is a very hot topic, because markets in the world around us has changed overnight. There were signs of this and transformation occurring prior to, and I do think we would still see a lot of what we're seeing today had we not, had the unfortunate circumstances of the pandemic. But that pandemic has really helped accelerate the work streams, the roadmaps, the business plans of many to go out and rethink and digitize their business. And that digital transformation is bringing and using data. It's the opportunity to use digital technology to fuel innovation while we rethink our business. So why now in the insurance industry, you might be asking? And if you looked around, I became involved in the technology space in insurance about 20 plus years ago. And it was obvious that we were sitting in a bubble, a business model, an industry that was in a bubble. The rest of the world around us was iterating and using technology to advance their business. And yet the insurance space is very, very slow to pick up, very much a laggard. But things are changing. And so you might say, why now? What's happened? And I'd like to point to four, we'll call it market drivers, that are fueling much of this desire and this change to digitize, to capture and analyze and use data. First is that fact of just data is more available today than it's ever been. There was a statistic that IBM published a few years back. It's probably 2018, 2019. So this is a little bit old, but still a very fascinating statistic. And they suggested that 90% of the world's data had been produced in the 2 years prior to this article being published. That's since the beginning of time, 90% in the last 2 years. So a rapid uptick in data availability. And it's amazing, but when you think about it, when you think about my next point, the rise of technology, the growth of technology, the amount of new tools and solutions coming to market, it kind of makes sense. These technologies weren't available prior to. The Internet of Things has spawned much of this data availability. IoT devices simply mean the ability for a tool, a piece of software to capture data, and that data being connected to the web, to the cloud, and allowing that data to then be utilized. So thinking it to your day-to-day lives, you probably are sitting in front of your computer, which is a connected device, with a phone next to you that's connected, with maybe a watch that's connected and a Fitbit on the other arm. These were present from the time you woke up to the time you went to bed, and in the interim, you were getting in your car that's connected, maybe flying somewhere, hopefully, we're getting back to that, somewhere. So your full day involves you being connected with a device to the cloud. And that connected nature is producing a lot of data. And more devices are coming to market that are gathering that data. Raymond Kurzweil, data scientist, publishes The Law of Accelerating Growth in Technology, suggesting that our technology advancements are on a hockey stick curve, that the advancements that we're recognizing in the 21st century, this is 100 years worth of advancements, is not really a true 100 years. That when we can, because of the growth rate, when we compare it to centuries prior to the 21st century, it is more equivalent to 20,000 years worth of advancements in the 100 years that is the 21st century. It's mind-blowing to think of that. But when you think of the rapid acceleration and enhancements of just the cell phone, the mobile devices, you can see, and you compare that industry's advancements to what, we'll call it, those of you that can remember back to a variety of industries where the growth and the change over the years, maybe even the automobile industry, hasn't been as significant as it has been in mobile device development over the last few years. So growth of technology, spawning availability of data. That data by itself doesn't do you much, but brought together, analyzed together in real time, outside of silos of those tools, makes that data really valuable, turns into information. And APIs, the ability for that data to be readily available in real time, are helping to turn the data into information in a more effective way, and in a way that which allows us to use the data to produce change, to drive outcomes. Now, you might not know what an API is, but if you have utilized and shopped on Amazon, you've experienced an API, and that API means connection, real-time connection with distributors. Amazon doesn't hold inventory. You're shopping for sneakers. You click in, I would like a pair of red sneakers. They are making an API call. That's the application programming interface, API, out to their partners and making a call and asking who has sneakers in their inventory, and the variety of partners are responding accordingly and pushing that information back to the user. Great user experience, utilizing data, utilizing APIs, utilizing technology. All of this, coupled with the experience that individuals are encountering in every other industry, is driving a need for personalization that folks are getting in other areas to bleed into insurance. We have digital natives that are now very active in the workforce. They've experienced technology from the day they were born. They've experienced personalization, folks using the data that's been gathered with their interaction with technology to drive a better user experience in every other aspect of the business. And they're demanding it in insurance and in employee benefits and in protection in general. And they expect that data to be utilized to their benefit. And so all of these four items, I believe, have really come together and come to head at the same time to produce the opportunity to better our industry, to better the employee benefits space. That, coupled with the pandemic, which, again, if there could be one silver lining of the awfulness that has come about because of it, it's the fact that people have been more open and receptive to change. They've been open to embracing new tools. They've been open to rethinking what they do and how they do it, and thus allowing that bubble that I spoke of that exists over the insurance industry to pop, or begin to pop at the very least. So how does this apply to employee benefits? What things should you be considering? You kind of now hopefully have a knowledge of why the opportunity exists, why the data exists, why the transformation is coming about, where the innovation is coming from. What should you be considering when it relates to employee benefit programs and health care and health insurance specifically? Well, the first thing is, those of you that are smaller in nature, that don't have the ability to gather data from their health plan, you still have data and you still can personalize it and use data to better the experience of your workforce simply by looking at who you're serving, what employees, what categories of employees from a generational perspective you have working for you, and does your health plan meet all their needs? Does your employee benefits package meet all of their needs? Are the tools and resources available to them to personalize their experience so that they're a more active, engaged, and efficient healthcare provider? I would challenge that many organizations haven't changed that much over the last 5-10 years, and yet their populations have changed significantly. That Gen Z workforce member has different needs than that baby boomer. The married family has different needs than the single person just coming out of college. The approaching retirement individual has different needs than the single divorced person. So I would challenge you to first take a step back and look at your population and make some changes and shuffle the deck of a benefits package that may have looked and smelled the same for the last 5 or 10 years. The next area that you need to be considering and looking at to access data would be your health plan. This is going to tell you about who your people are, about what they're struggling with, about where they are in need of solutions. A health plan is made up, 80% of it's made up of claims, things that are happening with your population. It's sitting there for you to be able to analyze. Now, if you're on a fully insured platform, you might not have access to that. So this is a call to action to say, consider partial self-funded programs, because it's within those solutions that you're going to receive access to data. You're going to be able to get granular, to be able to bring programs into place that can help your organization and your individual workforce. Because if you can't measure it, you can't manage it. This is a very famous quotation from Peter Drucker. And it's true. We have a very significant spend on our hands that is healthcare. It's not going to fix itself. It requires you to get engaged, to understand your population, to take the data that's available to you, to aggregate it and analyze it and start measuring it. And that's the charge. That's the data is there. If you're not utilizing the data to make information of it that drives decisions, then you're missing an opportunity. So getting and aggregating the data is not enough. You then need to provide and perform, should I say, the analysis on that data to drive and generate actionable insights. What can I pull from my data that'll drive my behavior and my strategy moving forward? So there's 4 different stages. The first thing is, what's happening with my population? What's happening with my data, within my data? Okay, then why? Why did that happen? Let's look at the root cause. Let's look at the population that's driving a certain amount of claims. Let's looking at the general trends of how my people are accessing care. Let's look at where they're going for care. Let's look at the procedures they're having. Let's look at all of that information. And then let's look about, well, if what predictive analytics, what do we expect to happen? That's the predictive nature. And then what can we help make happen? The prescriptive. These are where you're going to drive your actionable insights. This is where you're going to be able to put strategies in place that can help really change the outcome and the output of data moving forward, and ideally for the better, to make a better plan. Because if your plan is operating better, I will guarantee you that your people, our lives have been improved because they're accessing care maybe in a more quality setting. Maybe they're having tools that can help more effectively manage their challenges, their disease state, or their disease management. Now, as we move forward, we think about that. What can we do with the data as we analyze it? One of the biggest areas of opportunity, and there's a lot of movement in this space around transparency that has been driven by the government and a push from the executive branch to bring forth more transparency. This has been in place through a couple of the different terms and driven to help open up individuals' access to information about their care. Cost, quality, transparency. So the first thing I think that you really should tackle, because a lot of the strategies that you might put in place and the tools you might bring to help more effectively mitigate or manage risk or improve lives, unless you have an unlimited budget, they're going to cost money to execute. You have to build an ROI. So where do we find the resources to invest into our plan? And I'll challenge that with data, you can find the savings in those dollars and those resources within your plan. And one of the first places to look is at the cost quality of care. This data is available. This data is published. Your folks are accessing care without changing any of the care they're getting, without changing their condition. You can produce savings within your health plan by finding the health systems, the doctor's offices, the doctor's groups that are performing better than others, that have a higher quality mark, a better outcome for less cost. Cost and quality, there is no direct correlation, unfortunately. So it requires you to do some digging, to dig into the data and find those opportunities for savings by going to the higher quality health system or hospital and contracting them and having some discussions with them, either on your own if you're a big enough organization or through a partner that can help drive and build these direct contracting relationships with higher quality. Same claims in a more cost-effective, higher quality setting is going to equal savings. Savings that you can then turn around and invest back in your program to help your employees more effectively manage their chronic diseases. So which is the second piece that we're going to speak about. But in addition to you having transparency into claims and cost and quality, your employees can have access to that as well. There's a number of different tools, Healthcare Blue Book, My Medical Shopper offered by Talon, Buoy, another resource, all of which they're allowing employees in real time to access cost, quality, or diagnoses, or direction, or concierge services, guidance to where and how to receive the most effective care and what the cost is going to be prior to going into the engagement. It's amazing that in our industry that has not existed before. Nobody would ever go buy something without knowing what it was and just associating a higher cost with better product. But that's been our industry, and that's beginning to change because of, again, access to data. So cost quality access at the grand level by you, the administrator, and then at a granular level by your workforces and you're providing them the tools to help them be engaged. Now, in addition, you can dig into your claims to find pockets of struggles, people within your organization that are struggling with certain catastrophic illnesses, certain lingering challenges, things that are more than likely impacting their way of life. And if you can help them, I always say that innovation starts with helping improve the lives of innovation. If you can bring a tool into play that will help improve their lives, the net result is your plan will operate better. And you know what? It's helped an individual. It shouldn't be all about the cost. If you lead with the why that we're out there to help our population live healthier lives, it will come back to benefit you from a cost perspective within your overarching health plan. So this is an example. You have challenges with mental wellness. There's tools like Total Brain. Women's health, hospital and a network focus 100% on the needs of the women in your organization or on your health plan. Livongo is a diabetes tool, and there's a number of them that exist today. And then Vivante, digestive health, all of areas that are driving significant claims, and actually not just because of those particular illnesses, but then also contributing to other illnesses down the line. So create some savings, finding hospital networks, finding savings in your claims that then can be invested back into your program to maintain and to help people manage their care. And then the last strategy would be more long-term solutions, taking that data to help drive employees into a different delivery mechanism for receiving care. An example of that would be direct to primary care and changing the way people are accessing care to hopefully help them cut off any potential illnesses that might be developed because of being proactive with the way that they receive care as opposed to reactive. All of which can be tracked and measured within your health plan with access to data that is now more readily available than it has ever been before. What's next, you might ask? I don't know. Check out the Jetsons. Seems like they were pretty on point with a lot of the advancements in technology that were going to come about. And I say that with jest, but the reality of it is the insurtech space is blowing up. That people have consumed and realized that data is available and the opportunity exists for them to take that data and to help to create tools and solutions that improve lives. And I encourage you to become an active participant in that ecosystem, to engage with your data and to help find solutions that ultimately help improve the lives of your workforce and help you then impact your plan in a positive fashion. Thank you very much. We will pause now, and if you have any questions, my esteemed colleague, Heidi Cottle, our practice leader around innovative healthcare strategies, is available to take your questions. Thank you.
Okay, Bill, you have a question. Let me go ahead and ask that. So how do you see the integration of clinical data from employee medical records with claims data? Great question, Bill. So let me answer it in a couple of different ways. And just so you're aware, there are a couple of data analytics firms that are participating in the conference, HCRM being one of them. So I would ask you maybe to go visit their booth and get a little bit more information. And from the integration of clinical data, so there's a couple of different ways, and there are varying levels and varying degrees of data integration. So you need to make sure a couple of things need to happen before that takes place, Bill, which is part of your questions. Employee medical records can be brought in as part of, you want to make sure that HIPAA privacy is secure. And most of these data analytic firms have those security measures in place, but you want to make sure that that takes place. In addition to that, there are restrictions depending on whether you are on an ASO platform, administrative services only platform from a self-funded perspective, or whether you're with a third-party administrator. So you need to, the ability or integration varies depending on whether you're on an ASO platform or you're on a TPA platform. We are finding that the TPA platform is much more flexible and nimble in regards to not only securing the data, but also being able to release the data and being able to release the data at more granular details for the analytic firm then to identify and being able to utilize that employee information. Now, when we talk about claims data versus the clinical data specifically of employee medical records, then you do need to have an authorization from your employees to use those employee medical records if you were going to do it for various reasons. If you're only doing it for a high-level claims data analytics, that's one thing. If you were allowing, let's say, for example, an on-site or near-site clinic provider to look at that information, not only from a claims level, but also from the employee medical record to be able to look at like SOAP notes and those types of things, you will need to have a release, okay? We are seeing that employees, as long as it is being used for supporting their treatment plan and being able to provide that information at a clinical level only, and there's a firewall to the employer, that we normally don't see a challenge in getting the employee to sign off on that release. Are we seeing it being integrated? And the answer is yes. We are seeing that integrated for data analytics reasons, and being able to look at that as far as gaps in care, specifically being able to identify chronic disease states, and as Mark Ryder mentioned, the whole purpose of data analytics is to be able to support treatment plans and improve efficacy and improve quality. So for those objectives, all of those are obviously within the parameters of HIPAA privacy by being able to provide that scope and being able to look at that. So from the gaps in care perspective, that most definitely that is probably the broadest level that we see EMRs being used today. Now, are there ways, especially with digital? So diabetes, for example, a lot of the digital wearables that are available, we're seeing obviously those being used in treatment plans for providers. But then when it rolls up to the clinical data and the data analytics side, being able to validate that that wearable is improving that person's treatment plan and maybe avoiding unnecessary, visits to the emergency room or other forms of care. We are seeing that expansion into that next level. And then validating for performance guarantee reasons, being able to validate that whatever that point solution is offering to the employer, to be able to validate that in fact they have met what they propose. So for example, if I am evaluating a point solution and that point solution says, we guarantee that we are going to save you 15% off of this attribute in your medical spend, you have to be able to validate that. And a lot of analytics engines are able to do that within their analytics as long as that data is available. And being able to validate it from the point that you offer that point solution to whatever that time frame of that performance guarantee, we are seeing the application of that more frequently in the data analytics engine in order to be able to validate it. Okay, so from the question as far as how many NFP clients overall, I'll give you a general percentage of employers that are using this. Now, I'm going to quantify this. Most of these employers, again, to be able to use data analytics to the level that is being discussed in data are self-funded plans. Some level-funded plans we can get to, but again, it's still self-funded, an ERISA qualified plan. So having said that, we are now probably at 75% to 80% of our plans nationally, and part of that is depending on the sophistication of the client, are using data analytics and data analytics engines. We have national relationships as well as depending on what the need of the client is. We have also done some very sophisticated data analytics, and your question about predictive analytics is a little bit different in that we are able to extrapolate the data and being able to look at the data in a very specific way. Predictive analytics is being able to quantify if that condition goes unmanaged or that if the condition progresses. So there's different predictive analytics. Some of those use risk scoring and some of those use financial scoring. But on predictive analytics, predictive analytics is incorporated into that core data analytics engine and being able to predict what the cost is. And some of our data analytics from the predictive side are as up to 98% accuracy. So our predictive scoring, we're able to get within 2% of actuals, and we're able to validate that through several data analytics engines that we are utilizing. And your add-on question to that, how are the analytics being used to improve the health of the members? So as I mentioned in Bill's question about using data analytics and the employee medical records, part of the objective is to, again, reduce the gaps in care. And in reducing the gaps in care for members, it improves a quality of health. And that really is the overall objective for data analytics and data analytics engine, is really to improve health measures, whether, again, it's using population health guidelines or other guidelines in order to do that. Now, part of the improvement of health within members is tracking to those population health measures. And what we are seeing is significant improvement, especially in the areas of advanced primary care, that when we're able to address through different, again, in advanced primary care. So advanced primary care would be accountable care organizations, accountable care, which also do home type of care, as well as direct primary care. And those type of models, we're finding significant improvement in population health measures. And by being able to track through data analytics those population health measurements, we're actually able to quantify that. And we are showing significant improvement, and even through COVID, where things went to more of a virtual environment, we're actually seeing improvements in mental and behavioral health. What we have found, which was a little unexpected through our data analytics, was the fact that people through the behavioral and mental health actually prefer virtual care over face-to-face. And some of that through some of the recent surveys, Accenture has done a survey, Chamber of Commerce have done surveys, we have seen RAND do a survey, we have seen other surveys being done by McKinsey that all kind of point back to a couple of things. And those things are that people like virtual mental health and behavioral health because, number one, it can normally be done in the comfort of their own home. And they feel more comfortable, and they feel that they're more secure in discussing some of those more personal issues in that environment. So we don't see that as we open up a little bit more past pandemic, and we're seeing more one-on-one visits with providers, that the mental and behavioral health, as far as health improvement, that we don't see that changing much. Okay? So we're kind of at a point. Any other questions? Absolutely. So Bill's comment, let me read Bill's comment. As Doug Eby mentioned in the keynote speaker, and Doug is incredible, by the way, so I hope you enjoyed that keynote dialogue from him. But data analytics is critical to measuring outcomes and, as a result, better processes, without question. Without question. And that's why the topic today was, data is king, queen, and the royal court. As long as, and I'm going to qualify that, as long as it can be relevant, it can be measured, and that it can be actionable. And I think that last point, as Mark Ryder also indicated, that you have to be able to get to the point where that information is relevant and actionable. If it's not actionable, then you're not getting to that critical level of being able to measure it and then to be able to quantify it. And then again, on the outcome side, being able to validate it. So all of those are key elements to the data analytics side. So Bill, I agree with you and I concur with your observation. So any other questions in the last few moments? Okay. One comment I would make, and this has to do with maybe as you develop your performance standards and your performance guarantees. So there's a difference between standards, obviously, and the guarantees, which are financial, that you want to make sure in order to ensure that members of your plan have a voice. And that voice is validated through Net Promoter Scores. So making sure, and not all Net Promoter scoring is equal. So when you talk about Net Promoter scoring, that you dig down deeply into the questions that are being asked and that you have a way for the member to not only validate it within whatever point solution that is being, presented, but also that you have within that Net Promoter Score a way for it to be validated back to you as an organization. And I think that is really key to being able to identify not only are you improving from all of the scoring, but there is also a perception within your member base that you are reaching them where they're at. And I think especially with employers right now with 4 different generations in the workplace, being able to do that is an extreme challenge. And you want to make sure that you can get to the heart of your organization. So being able to have that in the member scoring through the Net Promoter Score is extremely impactful and relevant and actionable, because that then gives you the real-time ability to see if you are reaching the members where they're at. And so I would just encourage you to do that. Any other comments, questions, concerns that you have in this area? Because it is a significant area, as Doug has mentioned in his keynote speaking, but it's moving so rapidly and it's moving so quickly. To be able to stay ahead of it as an employer, you really need to make sure that you attend conferences like this, where at a granular level these things are being addressed. So within the data analytics realm right now, it is evolving, as Mark Ryder has stated, and the evolution of data analytics kind of comes in a couple of different categories. Obviously, making sure that it has all the protections of HIPAA privacy, security, all of those types of things, and most definitely that data analytics needs to be, as you break it down, you need to have access to data that is relevant, that you can look at, especially in a gap analysis where care is not being delivered appropriately and within normative data, which is under population health measures, et cetera, that are part of these analytic engines. So wanting to make sure that you have sufficient enough data to be able to speak to those items and being able to do that. So everybody's data is different, but there are a couple of key elements that are specific to these health conditions, as your question mentions. And that is extremely important as we talk about data analytics. That data identifies the areas that you need to focus on. Okay, so general data, when you take a look at what a fully insured carrier may provide you, inpatient hospitalization, outpatient, some of the general insights into what the care is being delivered. When you get into the self-funded realm, which is where data analytics has more meaning, that you're able to drill down into actually more specifics, and you're able to say, okay, with that chronic condition, and let's take diabetes for an example. With diabetes, is the patient staying consistent with their treatment plan, meaning, or if they're insulin dependent, and you can see that by the pharmaceutical data, are they getting their prescriptions timely? Okay, and if they're not, then what's the issue? And I'm going to give you a for instance, that in that type of situation, what we have found is that the data will identify, especially in the pharmaceutical data, that if that patient is going longer, let's say the prescription's 30 days and they're going 40 or 50 days, okay, what's the reason? Can they not afford the prescription? And so we can then put in various incentives in a value-based benefit design then to say, okay, let's get that person, up to their treatment plan guidelines. And if affordability is the issue, then let's put an incentive in there and see if we correct the problem. Let's see, and so data then becomes your baseline and your guideline to what you do in your benefits and what you do to correct the problem to improve the quality of health, and so you're not backfilling chronic conditions. So that's one of the most relevant things that I could share with you, specifically in the element of data and how to look at data and how to make that more meaningful such that you can bring a better quality of care to the overall continuum. What we have found is that when you look at data in what the overall costs are, you want to look at, as I generally talked about, gaps in care, but then you can also identify where your highest cost drivers are. And so two of the most that we see in general terms are inpatient hospitalization and pharmaceuticals on specialty and orphan drugs, okay? So let's assume for a moment that's where your highest costs are, but where are they? What are the type of diagnostic conditions that are driving those inpatient hospitalizations? And that's how you start to look at data differently. So if you find, oh my goodness, we have an asthma population that is, they're not staying adherent to their treatment plan, they're showing up in the ER, and then we're having hospital visits surrounding that. That's one area that, very easily remedied. Let's take a look, let's drill down as to what are those costs or what is driving that person not to then be adherent to their treatment plan. So we can look at it at a holistic level as to what is driving those costs. Hospitalizations, especially in cancers, okay? Cancer risk high. One of our clients, we did a lot of data analytics for that were all around certain types of cancer treatments. So what we did is within their self-funded plan, we went and did direct contracting where we were able to get almost a 200% cost difference, because if you look at the RAND studies, et cetera, you can see the cost of hospitalization. But that data is readily available also. That's what our PCORI fees are paying for. So those PCORI fees that we've been paying in both fully insured and self-funded plans, all of that data from hospitals and providers is being submitted to the Centers of Medicaid and Medicare Services. And so you can actually, without cost to you, go out and look at what those costs are for those hospital spends. And, there are data analytic engines that you can also then buy into depending on the data analytic provider. One of the data analytic firms is HCRM, and they're at the conference, so I would encourage you to go to their booth and to look at them. But they're able to actually give you some of those predictive costs and show you what your predictive costs are that you could do some direct contracting with facilities to reduce your costs. You can also carve out your pharma and go direct to pharma, the pharmaceutical companies, to also negotiate those fees. So there's various different ways that you can do that. So as you talk about data, there's a couple of things that I would like to add based on a couple of questions that we have had in some of the previous sessions that may prompt some additional thoughts for you. When we talk about data analytics, it's really key as we talk about being able to look at the data, being able to utilize the data most effectively, that there certainly is information that you can get on your fully insured carriers, but really where data analytics comes in is if you have a self-funded plan. And within that self-funded plan, it opens the door to a lot of different information. Now, I'm going to clarify some of the information that, as Mark indicated, is relevant and actionable and what you can do from a predictive standpoint, but more importantly, how can you improve the quality of life for your employees or plan participants on your plan. So if you go with, let's say, a carrier like an Aetna, Cigna, a United Healthcare on their platform, there are some limitations within their platform, not that they're trying to be difficult, but if you're just an ASO contract, there are some limitations on their platform because they build it on an HMO chassis, and that's why you'll see that United Healthcare offers UMR as a separate TPA service to be able to expand those capabilities. The same is true of Aetna and Meritain and others. So just kind of as a general overview there, we have found that there is more information in the other TPA type of services where you can get access and through a data analytics firm. And one of those firms, by the way, is a participant at the conference, which is HCRM. So I would ask you to go check out their booth, but that they can provide to you the ability to take in your claims and analyze where there are gaps in care, and then be able to provide clinical solutions to support that. So whether that clinical solution is for diabetic management or whether that is for any other type of chronic disease that you may be dealing with where there may be a gap in care. One of the most cost-effective integrative one that we have seen is in advanced primary care. So whether that is that you have a virtual provider that then refers into an accountable care organization or into direct primary care or something of that like, that we've seen a lot of cost efficiencies and improving quality of care. We've also seen digital technologies like wearables that in the diabetes management space where somebody can use a wearable device and be able to have that connected with an advanced primary care provider and improve their quality of life and also reduce your cost where you have avoid unintended visits to the emergency room and like type of situation. So there's a lot of different ways that you can then utilize data and bring it down to a very practical, applicable way that you can also improve quality of care to your members, as well as reducing costs to the health plan. So I wanted to bring that up because that was one of the questions that came up in some of the other sessions about affordability, cost savings, as well as bringing greater quality to plan participants. Well, we really appreciate your attendance at the conference. It's been an excellent conference. Thank you so much for your time.